If we're going to prevent similar tragedies in the future, we cannot continue to do the same things in the same ways in the long-term care system. We cannot. If the system didn't detect it before, it will not detect, deter, and stop it in the future.
Between 2007 and 2016, Elizabeth Wettlaufer, a nurse at several long-term care homes in Ontario, killed 8 of her patients. Her crimes didn't come to light until she herself confessed in 2016. In the wake of those murders, Ontario launched an inquiry into the safety of long-term care homes, and today the report was released. It makes 91 recommendations, saying the long-term care system in that province is strained and that systemic failures allowed Wettlaufer to kill her patients. So how is the Ontario government responding to the report, and what resources are they willing to commit to help ease the burden on the long-term care system and make sure something like this never happens again? Mary-Lee Fullerton is the Ontario Minister of Long-Term Care. She joins us now from Woodstock, Ontario. Hi, Minister. Nice to see you. Thanks for making time for us.
Thank you for your interest.
Minister, the Commissioner of the Public Inquiry did not make any findings of individual misconduct in her public inquiry. Instead, she found that it was, quote, systemic vulnerabilities within the long-term care system that allowed Elizabeth Wettlaufer to repeatedly kill and get away with it. Do you agree with that very basic finding, that it was systemic issues that led to that?
Well, we need a long-term care system that treats people with dignity. And I think that that's what we're moving towards. We need a system ready for the 21st century, and that is what our government is doing. We're looking at making sure that individuals within the long-term care system are treated respectfully and with dignity, and with the recommendations from the Justice and from the public inquiry, we're looking at new funding, understanding that there is a need. And I think as we go forward, also counseling for the victims, the loved ones, the victims' families, and understanding the recommendations after careful review. And so we'll move forward. We know that this is important to all Ontarians. And I was very pleased to be able to meet with one of the victims today and the victims' families.
Do you agree, though, Minister, and I'll apologize to you and our viewers for all the wind. Thanks for your cooperation. Do you agree?
Yes,
I just want to make sure I'm clear with that basic premise, though, that it wasn't an individual's responsibility or individuals doing, that this is a systemic failure.
Well, the Justice was very clear, and she actually states in the report that the system is not broken, it's strained. And I do have hope that as we move forward and looking at the recommendations with careful review, that the changes that we will be making over time will be very, very important for the quality and safe care of residents in long-term care and in home care.
Do you agree, though, with her finding that it was, quote, systemic vulnerabilities within the system that led to what happened with Elizabeth Wettlaufer?
Well, she's very clear, and she says in her report that this was not any particular individual or organization that is at fault. And so how do we move forward implementing her recommendations and understanding how we make the system better? And so I think that that's a very, very important point that she's made. And we want to make sure that we have a long-term care system that is responsive to the needs of residents and allow people to get the support they need when they need it.
You mentioned, Minister, the possibility of new funding. Your government has promised, and it was a key campaign promise, 15,000 new long-term beds. Will you be increasing funding for staffing to go along with those new beds, and by how much?
Well, we have to carefully review the recommendations because some of the recommendations were regarding staffing, but with 91 recommendations, there were other aspects as well. So we'll be looking at those and seeing what we can implement fairly quickly, and others that will take longer. But we are committing to new funding, and I think that's an important move forward.
What does new funding mean, and by when will that number be revealed?
Well, I'm sure you can understand with 91 recommendations that we've only had the chance to review over the last couple days, and understanding how important it is to get this right. So we know that already we have committed $1.75 billion over the next 5 years to increase capacity in the system, and $72 million more just this year. So we are now saying that we will commit to new funding to address the recommendations, but it will require a very, very thoughtful and careful review of the recommendations to see how that will be done. So we're hoping to have more news, and as we look ahead to July 31st, 2020, when we will have the report, we will look at having updates during that time to let people know about our progress.
The money that you mentioned, the $1.75 billion to increase capacity, my understanding is, I mean, you've made very specific promises on by how many beds you're going to increase, how many more long-term beds you're going to add. I think it's more than 7,000 now you've allotted funding for. The ultimate goal is 15,000. What I'm wondering, because at the time of those announcements, what I'm wondering is, has there been any specific money allotted for increases in staff? And I understand that that's part of the recommendations in this study, but even with your original promise of increasing those beds, is there a plan to increase staffing just to keep it at the levels it's at now with the increase in beds?
Well, that's something that we'll have to carefully review. 91 recommendations, all which are significant, and the Justice, I want to commend the Justice and her team for the work that she's done. She's done a very, very thorough job and has presented it very well today. And I appreciate all the work that's been done. And so the funding, of course, if we're building new beds and new capacity, those will have to be staffed, of course. So there'll have to be funding envelopes that address some of the recommendations, and we're going to carefully review how that will work and what that
is that
will
new
look
money,
like.
though?
I appreciate your...
Minister, has any of that money for new staffing for those 15,000 beds been allotted? And I'm asking you, and I understand that I'm asking a lot, but I'm asking repeatedly because your government has insisted in describing many of your funding decisions in other areas that there is only so much money, right? That the deficit is so big that tough decisions have to be made. So I'm wondering, will there be specific money for staffing, and when will Ontarians know how much money that will be?
It's clear that long-term care is a priority for this government. Our government has made campaign commitments. It's created a new Ministry of Long-Term Care, and I'm the new Minister of Long-Term Care. And I take this role very, very seriously. And listening to the loved ones and the families and the victim that was present today, it reinforces our need to make positive change in the long-term care system. We need a system that is going to respond to the needs of people when they need the care. And so we will be looking at a very thorough, comprehensive review of all the recommendations, and there will be new funding attached. So I appreciate your interest.
That doesn't, Minister, though, answer the question of when Ontarians will know if that new funding is coming and in what amount. Are we waiting for the budget, for example? Are we waiting until July 31st, 2020, when your government has fully reviewed this? At what point does that money start to flow?
Well, we will have to see. There are 91 recommendations. There's a lot of information there, and we are committed to long-term care. I think it's really clear. With a new ministry, and as I'm the new minister, we need to understand thoroughly how we can use those dollars in the most effective way, and where the new funding would fit to provide the most important support for our loved ones in long-term care.
So no timeline at this point at all, though, for when a decision will be made?
Well, yes, there will be in the coming weeks. There will be a comprehensive review. You have to understand that there is work to be done. The Justice's report was very, very thorough, and we will look at that over the coming weeks and have more news. We have also committed to July 31st, 2020, being the point in time where we will have a report based in a submission with our progress, and we will keep the public updated over the next year in terms of our progress on the recommendations. I think it's a very, very important report that the Justice has just finished and announced today, and I look forward to reviewing it more thoroughly.
All right, I'll leave it there. Thank you very much, Minister Fullerton. That's Ontario's Minister of Long-Term Care, Marilee Fullerton from Woodstock, Ontario. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video. Thanks for watching.